Hey friends, welcome to today's video. Today is going to be the greatest day of your life. Do you smoke cigarettes? You know, I smoked for years. I've quit smoking for about 10 years now. I used the patch on several occasions to quit smoking cigarettes. I would quit, then I would go back to it, then I would quit, then I would go back to it. Finally, over the last 10 years, I've been able to stay away from cigarettes, although, you know what, I still think about them from time to time. I enjoyed it, but it didn't enjoy me. It wasn't good for my health, and I know that I'm better off now for the last 10 years for having not gone back to smoking. And maybe you don't smoke. Maybe somebody you love smokes and you want to try to help them to quit and give them some motivation and inspiration to do so. Please share this video with them. You know, I am also going to put some links to some services that you can reach out to that can provide you some assistance and give you some advice on the best ways for you in particular to quit smoking. As always, you could talk to your medical professional about cessation activities and ways for you to quit smoking, or your loved one could do the same. But remember, quitting smoking means that you care about yourself. Now, the benefits from quitting smoking, believe it or not, are almost instantaneous. As soon as a person stops smoking, their body begins to recover in many ways. Now, after about 20 minutes from your last cigarette, your heart rate drops and returns to normal, your blood pressure begins to drop, and your circulation may start to improve. After 12 hours, cigarette smokes, as we know, contain many known toxins, including carbon monoxide. Carbon monoxide is a gas that's present in cigarette smoke. This gas can be harmful or fatal in high doses and prevents oxygen from entering your lungs and your blood. And when inhaled in large doses in a short time, suffocation can occur from lack of oxygen. Now, after just 12 hours without a cigarette, your body cleanses itself of the excess carbon monoxide, and your carbon monoxide levels return to normal, increasing your body's oxygen levels. Now, just one day after quitting smoking, your risk of heart attack begins to decrease. Now, smoking raises the risk of developing coronary heart disease by lowering good cholesterol and making it more difficult to complete exercise. But smoking also raises blood pressure and increases your risk of blood clots, which also increases your risk of stroke. As little as one day after quitting smoking, your blood pressure begins to drop, decreasing your risk of heart disease from smoking-induced high blood pressure. And in this short time, your oxygen levels will have risen, making physical activity and exercise easier to do, which will allow you to promote more heart-healthy habits and activities in your life. So after just one day, you're going to be able to get out there and go for a brisk walk, or maybe go for that jog you've been thinking about. Now, after 2 days, as we all know, smoking damages the nerve endings that are responsible for smell and taste. So in as little as 2 days after quitting, you may begin to notice a heightened sense of smell and more vivid tastes as those nerves begin to heal. After 3 days of quitting smoking, your nicotine levels in your body will have been depleted. If you're not using some sort of a support, such as the patch or some other mechanism of support that replaces nicotine in your bloodstream. And while it is healthier to have no nicotine in your body, the initial depletion can cause nicotine withdrawal, as we all know, right? And after 3 days of quitting, most people will begin to experience moodiness and irritability, severe headaches, and cravings as the body readjusts. Now, in as little as 1 month, your lung function will begin to improve. As the lungs heal and lung capacity increases, you will notice less coughing and shortness of breath. Also, after a month, your athletic endurance will increase, and you'll notice a renewed ability for cardiovascular activities such as running and brisk walking. Now, these are going to be above and beyond what you'd notice after your first day of quitting. But keep in mind, the longer you quit, the greater the benefits are. It's a gradual progression towards greater health as you have had your last cigarette. So after 1 to 3 months, you will begin to notice that this cardiovascular fitness and your circulation will continue to improve over the next 1 to 3 months. After 9 months of quitting, your lungs will have significantly healed themselves at this time. Now, what this means is that the delicate hair-like structures inside your lungs, known as cilia, that help to push mucus out of the lungs and help you fight infections, will have recovered from the toll of cigarette smoking. So at that point in time, what you can notice is the decrease in the frequency of lung infections, because your healed cilia will be able to do their job more easily. After a year of quitting smoking, your risk of coronary heart disease decreases by half, and this risk will continue to drop past the 1-year mark. So this is when you're really starting to see some great benefits. Now, after 5 years, cigarettes contain a lot of known toxins, we know that, and these toxins can cause your arteries and blood vessels to narrow, and these same toxins are also likely to increase your development of blood clots. Now, after 5 years of without smoking, your body will have healed itself enough for your arteries and blood vessels to begin to widen again. Now, this widening means blood is less likely to clot, lowering your risk of stroke. And the risk of stroke will continue to reduce over the next 10 years as your body heals more and more. Now, after 10 years of quitting smoking, your chances of developing lung cancer and dying from it are roughly cut in half compared to someone who continues to smoke. Now, the likelihood of developing mouth, throat, and pancreatic cancer will also have significantly been reduced. After 15 years of quitting smoking, the likelihood of developing coronary heart disease is the equivalent of a non-smoker. Now, similarly, the risk of developing pancreatic cancer has reduced to the same level as a non-smoker as well. And after 20 years, your risk of death from smoking-related causes, including both lung disease and cancer, drops to the level of a person who has never smoked in their life. Also, the risk of developing pancreatic cancer has reduced to that of someone who has never smoked. Now, smoking is a harmful habit that can cause severe health complications and death, as we know. And when you quit smoking, your body will start to naturally heal and regain the vitality of a non-smoker over time. Now, some effects, such as lowered blood pressure, are seen almost immediately. Other effects, such as the risk of developing lung cancer, heart disease, and lung disease, take years to drop down to the levels of a non-smoker, but it will happen. You will consistently get healthier. You will consistently get better. How that occurs will be specific for you and your individual habits. And each year of not smoking decreases your risks and improves your overall health, making quitting smoking an excellent choice for anyone who has ever started the habit. Hey, I used to smoke. It's a tough habit to kick. But you know what? Even if you were to go out and do a Google search for resources in your state on quitting smoking, states like Colorado have free resources. They'll actually send patches in the mail. They also have individuals whom you can talk to. When you feel like having a cigarette, you give them a call. They'll talk you through it and help you to move on past that craving until you have the ability to handle it for yourself. But it is an addiction, and it's very, very tough. I'm also going to list some resources in the description of this video that you could reach out to for some low-cost assistance in helping you or someone you love quit smoking. Okay? I care about you. I care about your health, and I want to see amazing things come your way. You can quit smoking if you smoke. If you don't smoke but you know someone who does, you can help them. But remember, we can't change people. People have to decide to change for themselves. But what we can do is we can help people make that decision by telling them that we care about them and letting them know how important their health is to us and how we'd like to see them live a longer life by quitting smoking cigarettes. Again, I'm not a doctor. I can't give any sort of medical advice. But if you smoke, please reach out to your doctor and speak to them about the options that are available for you so that you can just get rid of these damn cigarettes and move on with a healthier life, okay? Hey friends, I can't wait to see you tomorrow. I'm going to come back with some really great stuff. I just wanted to share this information. This always used to motivate me to understand the timeline of the benefits and changes that were occurring in my body after I had had my last cigarette. I hope it inspires you and motivates you or someone you love to make the choice to quit smoking. Have a wonderful day. I'll be back tomorrow. Take care.